Hello. Ever since schools reopened after the summer vacation, parents have been rather concerned about the number of infections afflicting their children. Everyone had hoped that after 2 years of COVID restrictions and online classes, finally children were getting back into a normal school routine with physical activities and social interactions which would not get interrupted. But that has not been the case. Children are falling ill, and just as they recover from one infection, another viral illness appears. Here are answers to the 7 questions that are bothering parents. Question 1. Why are we seeing so many infections? In the 2 years of the COVID restrictions, children did not get exposed to other children with infections, and therefore they really did not get the common viral infections they would have in a normal year. We need to remember that it is common for children to get 3 to 4 infections a year. After schools reopened, there have been a lot of exposure, and infections that would have, spread over an extended period of time in 6 to 9 months are now presenting in the course of a couple of months. Question 2. What are common infections that we are seeing? We are seeing influenza, COVID, common cold. Influenza could be either H1N1 or swine flu or H3N2. We are seeing a very mild version of COVID caused by the Omicron variant of the SARS-CoV-2 virus. And of course, we are seeing children with a common cold which is caused by a rhinovirus. Question 3. Can parents distinguish between these different types of infection? The answer is no, because the presentation is very similar. They all can cause fever, sometimes a running nose, at times a cough, body aches. The good thing is that all these infections are short-lived and the children get back to their normal self in about 5 to 7 days. The hand, foot and mouth disease is also a disease that we are seeing, and many parents can make the diagnosis themselves given the typical skin manifestations. This disease is also short-lasting. Question 4. What medication should one use? The only medication that we recommend that can be given by a parent is paracetamol. Sometimes we use nasal drops, sometimes we prescribe cough medicines, but it is best to get in touch with a pediatrician, and based on individual symptoms, the pediatrician can decide on what medication to prescribe. Question 5. What about vaccination? Well, as far as COVID vaccination goes, one must strictly adhere to the guidelines that the government issues in terms of which vaccine to be given and in which age group. About the influenza vaccine, please have a conversation with a pediatrician and take a call on vaccination. Question 6. What about extra vitamins to prevent infections? The answer is you don't really need extra doses of vitamin C or D because they're not likely to help. What a child needs is a balanced diet with the right mix of carbohydrates, fat, protein, minerals, vitamins. So one needs to emphasize the adequate intake of vegetables and different types of fruit. Question 7. When should a parent get worried? One should only get concerned if the fever is very high, the child becomes listless, starts to vomit repeatedly, develops severe diarrhea, refuses to accept water, or becomes lethargic. If any of these features develop, please get in touch with a pediatrician. We need to be aware that what we are seeing is not extraordinary in terms of symptoms. It's just that the number of children getting infected is higher and that children are falling ill with another infection at a short interval. So please do not panic. This phase too shall pass.